What is up, and welcome to world number 4 of Power Up Endo's 90-day Super GP. In this world, we've demoed for you a 2-rooted premolar live case demonstration. I hope you took a ton of value out of that case demo, and it's really getting you fired up to perform more endodontics in your general practice. The didactic component of this world is dedicated to instruments and supplies. This is a short video lesson where I'm going to walk you through with some photographs of my operatory after it's been set up, and it's going to save you literally hundreds of hours of research, number one, into determining which equipment and supplies you need to power up your endo game in your general practice. But also, the location and the way that everything is set up has been fleshed out over years and years of optimizing the office and optimizing the setup so you can be as time efficient as possible with your procedures and your patients are in the chair for as little as time as possible. This is a super critical component so that you can maximize your productivity and really thrive and master routine endodontics in your general practice. So without further ado, let's get right into it. There's going to be some unbelievable downloadable resources in this world. Okay, so you're going to find photographs that I'm going to be presenting to you so that you can refer to them and that you can set up your operatory in this manner and then eventually train your dental assistant to set up the operatory in this manner, or if you want to make some mild modifications. I wouldn't, because this is the perfect setup, number one. And number two, I have a spreadsheet that you're going to be able to download with exact item numbers, vendor names, and product numbers so that you can very quickly go about ordering a lot of these same instruments, equipment, and supplies that I'm recommending to you, and that's going to save you a ton of research time as well. So without further ado, let's get right into it. So again, World 4, Level 1, Instruments and Supplies. So first, let's touch on magnification. Obviously, as an endodontist, I use microscopy when I perform my endodontic procedures. I was trained to use a microscope from the get-go, and so I use a microscope for my endodontic procedures. Now, when I was a dental resident and I was moonlighting in general practices, okay, I didn't have a microscope, so I used my loupes. And even still in my practice, if the operatories that I have equipped with microscopes are either being used or they're being turned over, if the schedule gets really hectic, I'll throw on my loupes and perform my endodontic procedures with my loupes. Magnification in the form of a microscope is not mandatory in endodontics. It's a nice to have, and for very complex cases, it's generally highly encouraged. But to be honest with you, for the majority of endodontic procedures, routine endodontic procedures, you can get away with some nice high-powered loupes as long as you have a very bright light attached to it. Really good illumination and moderate magnification is a good idea to have. I have 6x loupes by Designs for Vision. You don't have to have loupes that high in terms of the magnification. It is going to help you, but you can get away with 3.5, 4.5x loupes, especially if you're handling just more routine cases. You don't have to have a surgical microscope to perform endodontics. Not to mention, we've been doing endodontics for hundreds of years. The surgical operating microscope only came into being in endodontics in the 90s. So there was a lot of great root canal procedures performed prior to the adoption of the surgical operating microscope in endodontics. Now, granted, it's nice to have, but it's not a mandatory thing by any stretch. So this is the operatory setup. So I've highlighted the 3 main areas where you're going to be setting up equipment and instruments, okay? And we're going to go through each area one by one. So here's our first area. This is the area behind the patient. We're going to go through each item here. Here we go. So first we have our Ultra Cal, okay? That's your calcium hydroxide setup in the syringe. Then we have our cotton pellets in a little cup. We have our endo ice set up there, and we have our rubber dam apparatus. That includes the frame, the rubber dam itself, the hole that's been punched in the rubber dam, and then the appropriate clamp for the given case, along with the forceps. You want your assistant to have an idea as to how you're going to isolate this tooth that you're going to be treating prior so that he or she knows how to set up the rubber dam. So if you're going to do a single tooth isolation, obviously you're going to use whatever clamp is necessary to clamp that given tooth. If you're going to be doing a split dam, you want to tell your assistant that so that they can set up the appropriate clamp, because if you're going to be performing root canal treatment on a second premolar and you're doing a split dam, they're going to need to set up a molar clamp, right? Because you're going to be clamping the tooth distal to the one you're working on. Also, they're going to have to punch 2 holes in the rubber dam that are overlapping. So you want to have your assistant be, on the same page with you as to how you're going to isolate a given case before you walk into the room to actually go about doing it. We have our rubber dam, and then we have our scissors there off to the side. And then we have our anesthetic setup, okay? For the majority of cases, especially if there's no epinephrine contraindication, I would recommend you utilize Septicaine. And so you have 2 cartridges of Septicaine ready, because that's going to be realistically all you need for most of your endodontic cases. And if epinephrine is contraindicated, then you may want to use Carbocaine, okay? We have our Endo Explorer, or DG16. Then we have our cotton pliers. You want to have 2 cotton pliers in your setups, okay? I prefer non-locking. The reason that I prefer non-locking is because I will have the dental assistant oftentimes hand me items while being loaded in the cotton pliers. And if it's locked, it's easy to get mixed up when you go ahead and seat whatever it is you're seating, whether it be a paper point or whether it be a gutta percha cone. I just prefer the non-locking cotton pliers. And we have a metal mouth mirror, okay? That's not necessarily what I'm recommending to use for your visualization, because I like the Zerk HD mirrors. If you want to use the metal mouth mirror, that's fine. We use it for other things, like for our percussion tests and whatnot. You want to have cotton rolls set up, not just for your biting tests when you're doing your examination, but also if you need to do some cleanup with a cotton pellet or for any other reason. Next, we have our surgical aspirator, okay? That's going to be the surgical suction tip in white in the bottom right. You're going to have your assistant switch to that as soon as you start using your sodium hypochlorite after you've done your access preparation. Then you have your K files lined up at the bottom of the tray. You're going to figure out which K files you tend to use or don't use. So you want to only lay out what you think you're going to use for the case. But my assistant sets up a couple of 8 files, a couple of 10 files, a couple of 15s, and then maybe one of each of 20 to 40. This way we have that handy. Then we also have our sealer handy, okay? Because in most cases, we're going to be performing 1 visit treatment. Not in all cases, but in most cases. So you want to have your sealer really, really handy. Then we have our irrigating solutions, okay? So we have our sodium hypochlorite and we have our 17% EDTA. For the hypochlorite, we use a 10 milliliter syringe and we fill that up. There's a reservoir in the blue cup on top there that I'll get to. And then we also have the smaller syringe for the 17% EDTA. We use a 27 gauge irrigation needle and the length of that needle is 1 1/4 inches. Then we have our Glick plugger, okay? The Glick plugger is going to be for manipulating our temporary restoration once we go ahead and place that. If you are going to be performing a definitive restoration, then you may want to have some sort of plastic instrument that you use for, shaping your composite resin. Then we have a measuring block, okay? This is a great tool so that your assistant can do some measuring. The measuring block device, that big silver block, is nice. It's really easy on assistants, especially if their vision isn't so great, because they can just drop gutta percha cones right into the hole at the appropriate length and then grab it right at the base, and they have a really, really precise measurement from that. You need some 2x2s handy to wipe your rotary files as you're going ahead and instrumenting your case. And you want to have a Gates Glidden handy. I always have a size number 4 Gates Glidden handy. I don't use it that frequently unless I'm preparing a post space, but it's handy to have in case you need it. Next, we're going to have a green sponge, or you can use a yellow sponge or whatever color sponge you'd like, but you want to have that sponge handy for the temporary restoration. Then you have a hemostat handy. You're going to use that to remove temporary crowns, and it's just nice to have. Also, a bite block. So you've probably noticed by now that I recommend utilizing an adult-sized bite block for the vast majority of your endodontic cases. Number one, so the patient isn't so tired with respect to holding open for a long period of time. And number two, so they don't go about closing on you as you're performing your treatment. It gets very annoying, not just to you as the operator, but also to the patient, in constantly reminding them to open their mouth throughout the procedure. So do yourself a favor and go ahead and utilize a bite block. Like I mentioned, the adult size is what I go for 9 times out of 10. If the patient truly can't tolerate the adult size, I'll use the child size. It just makes it a little bit more challenging to have, obviously, a great visualization. Then we have the finger ruler. This is the ruler that I wear as a right-handed operator on my left index finger, and that's there on the tray itself. Now we have a mixing pad with the RC Prep loaded, and we'll be utilizing that after we wipe our rotary file. We load the file with RC Prep and then deliver it and go ahead and instrument the canal. And we have 2 rotary file setups. We have a 25 millimeter and a 21 millimeter setup. We have both out so that when we go about taking our working length measurements, whichever is most appropriate, we'll go ahead and open that pack. But you don't want to just have the 25s handy, for instance, and then you end up wanting to use a 21 length and your assistant has to go shuffling around to try to find that. You want to have both handy so that there's no waiting for your assistant to go find a different length rotary file. Next, we have our gutta percha cones in a box. Okay, this is the Vortex system that matches the Vortex Blue rotary file system that I use most often. Now we have paper points. Okay, so like I mentioned, I recommend the Pro Taper paper points in the F2 size by Dentsply, and we have a pack ready. I personally advocate for aspirating out your irrigant solution so that you don't have to use so many paper points. So in the vast majority of the time, a single little pack of paper points will do the trick. And then you want to have an extra reservoir, like I mentioned, of sodium hypochlorite. So I keep this in a blue cup. This way, if I go through the entire syringe, which I frequently do, my assistant can simply unscrew the needle and then draw up a whole fresh batch of sodium hypochlorite from that cup, and then put the needle back on, and we're ready to go again. There's no waiting around for, getting bleach, diluting it, and all that stuff. Okay, we just have it handy. And then we also have our Buchanan hand pluggers. Like I mentioned, sizes 1 and 2, the red and the blue, handy for obturation. And then finally, in the event that I need extra K files, that's there in a triangle sponge, ready to go. If I ask for extra K files, my assistant will simply open the pack and go ahead and reach for that. As you can see, we use a tray with sterile wraps, and the wrap is opened over the tray, and we have a nice sterile area where all our instruments are lying in that sterile wrap. I would highly recommend you do that too. So now we're moving on over to the tray with the hand pieces, and we'll go over everything that's set up there. Okay, so as you can see, you obviously have your hand pieces. You want to have your high speed and your slow speed hand piece ready, and then your apex locator is placed here. I recommend the J. Merita Root ZX, whether that be the first model or Root ZX2. And then for the majority of my visualization, I really like the HD mirrors, okay? So Zerk makes an HD mirror that is significantly better at reflecting light. It just creates a much clearer image to work through. I would highly recommend you utilize this for your endodontic procedures, especially considering we're working in such a tiny area. We want as much light reflected into the working area so that we can see what we're doing. And once you start using this mirror, when you go back to a metal mouth mirror, you think that, it's impossible. You can't even imagine how endodontics was performed without an HD mirror. It makes a big difference. I would highly recommend you go ahead and pick these up. Then we want to have a space to place our dirty files. So once a file is used, hand or rotary file, and it's dirty and it's done, I go ahead and place it in that sponge. And then we have our assortment of burr. I go through all the burrs that I recommend in the Power Up Endo method, but you want to have a burr block to store all these burrs and have them handy. And my assistant knows to place them in a very specific setup: 2-4-6 round, high speed, 2-4-6 round, low speed, an Endo Z burr, and then a football burr for occlusal reduction, or a chamfer burr for the chamfer diamond for occlusal reduction as well. Another finger ruler in case one falls. The assistant accidentally takes the other finger ruler because she doesn't want to use the block, but 2 finger rulers is good for a setup. And then patient safety glasses. I like the shaded safety glasses. A lot of you do too. They're fantastic for blocking out a lot of the light, especially in endodontics. We use a lot of light, and patients just kind of want to zone out. In our practice, we have televisions where patients can kind of zone out watching a television, and with the sunglasses and the TV, oftentimes they're there in such a short amount of time, they can't believe how easy of an experience it is. And now we're moving on to the counter space, and we'll go through what's on the counter space. So first we have our endo rotary handpiece, okay? The Aseptico 8-to-1 mini head is fantastic because it's the head is smaller, and so it's easier to get into tiny little spaces. An Aseptico endo motor, and the motor itself is not a super critical component. I like these motors, but I also use other motors as well. If it spins, it'll work for me, essentially. There's other things that I'm picky about. This is just not one of them. And then we have our System B. This is a great heating element. It's a little bulky, but these things will last you your entire career. You can drop one of these from an airplane and it'll still work. Somehow they're just indestructible. And the heat tip that you're going to need to obtain for the System B handle, okay, I recommend the Buchanan heat plugger in the fine medium 08 size. That's a universal size that I use for all my endodontic procedures. And there you have it. That's the entire setup. It's a lot of instruments and supplies, but hopefully you can see how it's set up to optimize your workflow. And like I mentioned, I have great downloadable resources for you, so you can have photographs of an exact setup, and you can have an Excel spreadsheet of exactly everything that you're going to need. This is going to really change the way you perform your endodontics, and it's going to make you super time efficient, so you can power up your endo game and master routine endodontics. I will see you in the next lesson.